Hi, my name is Brian Apavu. Today I want to dive into the condition known as self-limited epilepsy with autonomic seizures, currently called SeLEAS. It's an epilepsy condition we've heard in the past, and neurologists and epileptologists have referred to in the past as Panayiotopolous syndrome. So with SeLEAS or Panayiotopolous syndrome, this is what we consider a self-limited childhood onset focal epilepsy that's characterized by seizures with prominent autonomic symptoms, most notably vomiting, pallor, and autonomic disturbances. It is recognized by the International League Against Epilepsy as a self-limited epilepsy with autonomic features, and that's where it gets the acronym. The condition affects about 6 to 13% of children at ages of about 1 to 15 years of age who often present with non-febrile seizures, and the peak of onset typically is around 3 to 6 years of age. The seizures can be often prolonged, up to 30 minutes in up to half the cases, and they typically begin with autonomic symptoms, some vomiting, pallor, flushing of the face, cardiorespiratory changes, maybe some tachycardia, maybe some incontinence with it. And they can progress to having impaired consciousness, head or eye deviation, and occasionally hemiconvulsive activity involving one side of the body or generalized tonic-clonic activity. Most of these seizures tend to occur during sleep or upon wakefulness. Despite the dramatic and sometimes lengthy seizures that can be associated with this condition, it's generally considered a benign condition. Most children have neurodevelopment and normal intellectual function with this condition, but some mild cognitive and behavioral comorbidities have been identified. Issues related to internal behavioral problems, mild academic achievement, underachievement, and so forth. Children generally live normal lives, and the seizures self-resolve within 1 to 2 years after the seizure onset, and there is no increased risk of epilepsy into adulthood. Panayiotopolous syndrome or SeLEAS is commonly misdiagnosed in times as encephalitis, syncope, migraine, sleep disorders, or gastroenteritis because of the autonomic features associated with it. As with all my videos, please bear in mind this is medical education. This is not medical advice.